really wanted to do something different with our practice. We were feeling like we needed to make more of a commitment to the patient and to have a funding model that better supported the continuous relationship between a family doctor and their patient. So we brought in a number of different pieces of family practice reform, including the signing up of patients, a different funding model, using a team of healthcare providers, and using an electronic health medical record to measure our outcomes. We started our change in 1996 as one of the federal pilot projects and have continued on to the current time. It really has provided, I would say, transformational change in the way that we provide services to patients. So we're really able to look at who's the best provider for the service and to delegate that to the best person in the practice. So as a physician, it's changed what I do. I delegate a lot more things to my registered nurses, my other allied health professionals, even to my clerical staff, and has allowed me to have a more stable income so that I know that I can afford to have those allied health providers working for me. At the beginning, we make a commitment to the patient that we're going to do our best to provide all of their needs and they can come to one place for medical care. For patients, they say they'll do their best to come to our office for care, and it allows us to think about each service and how can we be more efficient and meet the patient's needs. Not all of those needs are met by physicians. They may be a combination of other staff that we use. So it's really a team effort, and recognizing that patients are individuals. And for some patients we may need a big team, for other people they're in very infrequently. There's a lot of terms to describe this. Sometimes it's termed attachment, enrollment, registration, signing up for the medical home. But it's a signed document between the patient and the physician, and it's really a commitment on both sides to work together to get the patient the best care that's available. Really, it's a change in how we approach care and how we think about care. So thinking about the patient is always my patient, whether or not they're in the office. They're always my responsibility. So if I receive a piece of information back on that patient, whether or not I've seen them recently or not, I will still deal with that, connect with the patient, and if the patient's due for something, I may phone out and ask them to come in. So it's really a two-way relationship. So it's different than just a reactive relationship waiting for the patient to phone the office and come in.